Hi there. Welcome everyone to Project Echo Care of Older Adults. My name is Pam Yankee-Love, and I'm the Director of Research at the Trager Institute. And this Project Echo Care of Older Adults is with the University of Louisville Trager Institute in partnership with the Kentucky Coalition for Healthy Communities. And we are glad you are here. We do ask that you go on and keep your video on if you can do so, and just go on and mute yourself. If you have a question or a comment, please just go on and raise your hand. You can go on and chat, or you can unmute. If you're having difficulty with your sound or your video, just go on and click on your arrow next to your microphone and video to test your system. We do ask that you go on and put your name and your organization in your video square. There are two ways of doing that. You can click on your little video square in the upper right-hand corner, and there's a little dialog box that comes down. You can click on rename and put your name in there and your organization, or you can go to the participants section and do that. So if you're unfamiliar with the University of Louisville Trager Institute, our mission is to help individuals optimally age throughout their lifespan. We do this in a variety of ways. We try to help individuals have a very long health span, and we try to work on changing the attitudes and the knowledge of interdisciplinary team of individuals, both those that are in their training, in their professional training, and those that are working in the field. And so that work is, all these three bullets here are supported by our grants from HRSA. The next thing we try to do is we try to change the practice environments in which the individuals work, whether it be a primary care or a nursing home or a emergency department, always trying to change the way the systems are so that they're more age friendly. And lastly, what we try to do is transform our communities, whether it's our families, our neighborhoods, or our much larger community. And collectively, we are trying to help individuals be able to optimally age by working on the work span, the clinical practice, and our communities. And as I said, this particular project echoes in partnership with the Kentucky Coalition for Healthy Communities. And I'm going to go on and pass the mic to Mona Huff.
Thank you, Pam, and welcome to all of you. We're glad that you're here today. Our Kentucky Coalition for Healthy Communities, our mission is to create and to help community support systems for the older adults in partnership with the coalitions that are existing in their own communities and other organizations. Also, we're very interested in helping develop the workforce and concerned community members to empower our communities to become healthier. And toward the end of today's presentation, we will learn some ways that we can do that as we apply what we learned today to our communities. So again, welcome. We're really glad you're here.
So our Project Echo Care of Older Adult is driven by age-friendly healthcare system principles. And if you're unfamiliar with this is a concept that was developed by the Institute for Healthcare Improvement and the John A. Hartford Foundation, and it focuses in on what's called the 4 M's. So that when we're working with older adults, that we always assess the 4 M's. And so the 4 M's constitute what matters most. So it's looking at the values of the individual that you're working with and making sure that you understand how those values play a role in the health goals of the individual. When we're working on medication, we're trying to make sure to review any high-risk medications and possibly prescribe if necessary. Always want to make sure we have mobility goals for our older adults, making sure that our older adults move safely. And with mentation is just another word for mind and mood. We're trying to prevent, treat, and manage depression, dementia, and delirium. This is our 2025 schedule. Today, we're going to be talking about transforming health, reducing chronic disease with lifestyle medicine. Then we're going to take a break in August. We'll be able to take all the information that Sam Cotton is going to share with us and maybe implement it through the rest of July and August before we begin again in September. We're going to be alternating between lifestyle medicine topics and our more eclectic topics. So in September, we have nutrition and bone health. In October, we have fall vaccinations for older adults. In November, we have cognitive decline and dysphasia. And December, we end the year with blue zones and healthy aging. So we hope that you've signed up through Project Echo so that you can be a part of our Project Echo community. And if you're familiar, unfamiliar with the Project Echo platform, it's been around for over 25 years. I was literally just on the site about an hour ago looking to see how many Project Echoes there are. There's Project Echoes in over 214 countries. There's over 8,000 different Project Echoes. So it's pretty interesting. Sanji Arora, who's an MD at the University of New Mexico, he developed this platform. He was having patients drive several, 100 miles to come to him for his knowledge, and he felt he was doing a disservice to all of the patients that needed the same kind of knowledge. So he decided to develop this platform. It's a telementoring platform. The idea is not to move the patients, but to move the knowledge and to build capacity at a local level. So every project Echo typically has a rhythm to it. There's some case-based learning. And in ours, we're teaching best practices and interdisciplinary team-based care for older adults. And we can provide an attendance certificate for the 1.5 hours for today's session by completing the evaluation at the end of the session. And if we have any certified community health workers with us today, we do want you to know that you must go on and complete that evaluation in order to receive the certificate. And our presenter has nothing to disclose. And as we said, our CHWs are approved for receiving 1.5 continuing education units for this particular session. And today we have Sam Cotton presenting on transforming health, reducing chronic disease with lifestyle medicine. And Sam, I don't have a bio for you.
That's okay.
That's my bad. I'm so sorry.
Totally fine.
Sam is actually filling in.
Yeah. So lucky for you all, I was not originally scheduled to do this presentation today, but our dear colleague Kristen is not feeling well. But lucky for you, our lifestyle medicine bench of expertise at the Trager Institute is rather deep. So I'm sure there's a number of other colleagues that I have that could have jumped in to talk about this. But let's go ahead and get started. Did you still have her information on there? Yeah, perfect. So I do thank her for pulling this together and allowing me to use this content for today. And she has some really great information in here that I think you all will really enjoy and learn a lot about. A couple of things about me, for those of you who don't know me, I'm a faculty member at the Trager Institute. I work across a number of different grants that we have, but for the purposes of what you need to know today, I'm also board certified as a practitioner in lifestyle medicine. And in my work with individuals with chronic conditions, specifically, I work a lot with individuals with Alzheimer's disease and related dementias. I have found really reframing the conversation as it relates to chronic conditions and infusing lifestyle medicine into some of the work that we do is particularly profound for those individuals and their caregivers. And a lot of times when we talk about chronic conditions, individuals often lose a lot of hope when especially when they're first diagnosed with something. And what I see the value in a lot of this work related to lifestyle medicine is it really helps us feel like we can have a part in our care and also really provides that hope for us in making these changes. And I do have to quickly acknowledge that since Kristen put this together, she is a HRSA-funded Geriatric Academic Career Awardee, and so that helps fund a lot of her work in this space. And today we're going to be focusing on the prevalence and impact of lifestyle-related chronic disease among older adults. We're going to walk through really how to better understand what lifestyle medicine is and the impact that it can have on chronic disease, not just prevention, but also management. And then really thinking through for a lot of you who are working out in the community, how do we apply some of these concepts in care planning and patient education with older adults? So when we look at chronic disease rates, as you can see here, what we're really seeing at this moment is what I would call a crisis point, unfortunately. Chronic diseases like diabetes, hypertension, Alzheimer's disease, and other types of dementias are really on the rise. And when we start looking at our older adult population, they really carry the highest burden of this, with about 80% having at least one chronic condition and 68% having two or more chronic conditions. And most chronic diseases are driven by preventable lifestyle factors. So things like poor nutrition, sleep deprivation, tobacco or alcohol use. And when we start talking about it from this framework and looking at lifestyle medicine as a really amazing intervention that we can use, it's important for us to understand that these are modifiable risk factors, meaning that these are risk factors that we or the patients and caregivers that we're working with have the ability to change. Um, of chronic diseases like heart disease, cancer, and diabetes, since those are the leading causes of death and disability in the United States, we do know that around 70 to 90% of those types of chronic diseases have been shown to be preventable by lifestyle modification, meaning looking at things like nutrition, movement, or exercise can really be helpful in this space. And something I also really think is important for us to think about is the fact that very few Americans are leading a healthy lifestyle. This 2016 study here found that only 2.7% of individuals had a healthy lifestyle, as defined by these four indicators that you see here. And I want to share something really quickly that I have experienced in this space is that a lot of individuals, when you ask them if they're leading a healthy lifestyle, they're going to tell you, oh, yes, I'm very healthy. And I'll give you an example of this. I was working with a patient about 2 or 3 years ago doing a lifestyle intervention focused program with him and doing several assessments. And I made the mistake of asking him in our conversation while I was doing these assessments, do you eat healthy? That was sort of my question. And he, of course, said yes. And left it at that. And during the course of the assessments or the conversation, I decided I needed some more information because I really was struggling in my work with him. And so I asked him to describe what a normal day looked like for him, what he was eating, and how he could show me that that was healthy. And he started describing his normal day. And he lived alone, was single, and wasn't cooking for himself frequently. And typically, his normal day was he was going for breakfast and lunch to Cracker Barrel. And so he started describing to me the meals from the menu that he was getting each time. And he was pretty consistent in what he was getting. And so I pulled up the menu from the website and sort of showed him the nutritional where you could break down and look at this. And most of the meals that he was choosing were high in sodium, high in sugar, high in excessive fat content, and he was unaware of that. So again, I also think not only are very few Americans leading a healthy lifestyle, but there's also limited health literacy in this space for when you're asking questions for them to sort of understand what you're really talking about as well. And in general, also when we look at the United States, and I'll point out here, if you see the yellow, the highlighted yellow line here, we see that we have the most avoidable deaths of any OECD country, and that is the Organization for Economic Cooperation and Development. So looking at, that's an organization that looks at developed countries across the world. And when we talk about avoidable mortality, that includes deaths which are preventable and treatable. So you do see sort of the large spike there on this graph in 2020 for the United States, and that was related to COVID-19. And something I do want to highlight about that piece is we know that that particular disease was exacerbated by preventable comorbidities, things like type 2 diabetes, COPD, obesity as well. So again, when I say crisis, I think it's pretty much illustrated in this data. So that brings me to the whole purpose of this conversation today, and it's what can we do about this? We see that individuals are really struggling across the board as it relates to a number of these different areas of their life. I think it's really important for us to start pivoting that conversation to focusing on those modifiable lifestyle behaviors that we can be engaging in. And that's really where lifestyle medicine comes into play and can be a very robust solution to helping guide individuals that you're working with. Or if you're joining us today and you're kind of thinking about lifestyle medicine for yourself, also applying some of these principles to yourself as well. Now, for some of you who are frequent joiners of our Project Echo sessions, we do appreciate you, but you may have heard of some of these different areas in the past because we do focus sometimes on some of the, take a deeper dive in each of these domains during our Project Echo sessions. So some of this might not be necessarily new content to you, but I want for all of us to have this frame of reference and really understand some of the primary principles of lifestyle medicine. And that includes these 6 domains, which I'm going to cover in brief to just kind of give you an overview of what that is if you're unfamiliar. So we're talking about nutrition. Please note, I didn't say diet, I said nutrition. It's really focused on that piece. Physical activity, restorative sleep, stress management, social connection, and avoiding risky behaviors. So when we talk about nutrition, this is so foundational, and I always like to start here when I'm talking about lifestyle medicine because I think it's one of those critical things that we can do and focus in on in terms of our lifestyle medicine journey. And sometimes it's also the hardest for individuals. As it relates to nutrition, as I mentioned earlier with the person I was working with, there's a lot of limited health literacy related to nutrition. And society has really kind of overly emphasized diets and what I would call fad diets in the media. And so I think there's a lot of misinformation out there about this. But we do know that nutrition is really foundational in preventing and managing chronic conditions. So if you're thinking about diabetes, high blood pressure, heart disease, especially in older adults, nutrition is critical. And what we're talking about when we talk about nutrition is a plant-based predominant diet, which is rich in fiber, healthy fats, and whole foods, which can help lower blood sugar, lower cholesterol, and help with inflammation as well. And sometimes these simple changes can also reduce the risk of cognitive decline over time. Even small shifts, like maybe adding a serving of beans or adding a serving of leafy greens, can really support better aging and reduce medication burden over time. Next, we have physical activity. So physical activity is one of the, again, most effective ways. I always kind of lump it and nutrition sort of hand in hand of those first things we really need to focus in on to prevent and manage chronic conditions like type 2 diabetes, high blood pressure, and even cognitive decline. There's been significant studies as it relates to cognitive decline and physical activity over the last 3 to 5 years that really show that it can really help with your brain health. When we talk about physical activity, it really does improve insulin sensitivity, mood, and cardiovascular health. And for older adults, I think it's really important that engaging in physical activity can really help with muscle strength and balance as we get older. And those are things that are critical for preventing falls and supporting a person's independence in their own home. A lot of the older adults that I work with often tell me one of the things that matters most to them is staying independent in their own home for as long as possible. And so I see physical activity as one of those things that can be helpful. And when we talk about physical activity, I want to note that I'm not talking about running a marathon, right? Going from like scratch to running a marathon. But I would encourage everyone to kind of hit this goal, which is 150 minutes a week of physical activity, with at least 2 times a week of that being strength as well. Sleep is often overlooked in chronic disease care, and I know that I am in particular. This is always the part of lifestyle medicine that I'm trying to work on in my own life, but it's very essential, and especially for older adults. Poor sleep can really worsen blood sugar control, raise blood pressure, and increase inflammation, all of which are things that we know contribute to diabetes, cardiovascular disease, cognitive decline. And when we talk about Restorative sleep or quality sleep in lifestyle medicine, we're really talking about 7 to 9 hours of quality sleep. And for older adults, it's really important that we address common issues like sleep apnea, frequent urination, and pain that might interrupt rest. And better sleep can really improve energy, mood, and disease outcomes. Tobacco, alcohol, and other substances contribute to nearly every chronic disease we see in older adults. Things like cancer, cardiovascular disease, liver disease, even dementia. Um, Especially when we're talking about older adults, even moderate use can worsen blood pressure, blood sugar levels, sleep quality, if we're going back to the previous piece, and also increase falls risk. And so for those of us who work with older adults, we know that the concerns related to falls risk, especially in one's own home, is pretty significant. And these behaviors do often start earlier in life for most individuals, but if they continue into older age, we know that change is still possible. So it's really important for us not to assume just because we're working with an older adult that they're not struggling with substance misuse. And we want to really offer supportive, non-judgmental conversations and referrals to resources. And that can really make a huge difference in the care of the older adult. Social connection. This is something, when we start talking about health as a whole, we often forget about this piece. And social isolation in particular is a very serious health risk. It's actually, studies have shown that social isolation is worse than smoking 15 cigarettes a day, which just shows you the impact that social connections can have. It also increases the likelihood of things like heart disease, stroke, cognitive decline, and depression. For older adults, especially those who are living alone or with limited mobility, meaning they can't maybe get out and do those things that they enjoy to do in a social setting, loneliness can really erode their health over time. But on the flip side of that, we know that social connection is such a powerful tool, and in terms of the care of an older adult. So whether it's going to church or volunteering in the community, or engaging in support groups or just regular phone calls, really any intervention that we can do with the person who's struggling in this space can really help that older adult feel very connected, and improve those overall health outcomes. And stress. I probably don't need to do like a hand raise here about people having stress. I'm sure if I were to ask that question, everybody on this call would raise their hand and be like, I'm stressed. We all have stressors in our lives. And the same goes for the patients that we're providing care to as well, whether it be financial stability or concerns about their future, or even things that are going on in their family that they're really struggling with. Stress can have such a huge impact. And it can be sort of the impetus in some situations for the development and progression of chronic conditions like diabetes, hypertension, dementia. What stress does to our body is it really triggers inflammation. It raises our blood sugar levels. It can also impair our immune function as well. So our ability to really fight off viruses, for example. And so older adults really can face stress from for a number of different reasons. I was actually working with someone recently, and they were a caregiver, and one of their stressful sort of situations going on in their life was having this sort of anticipatory grief of watching their mother decline over time. So sometimes it's even things like grief, for example, that can cause these challenges. And so, one of the things that we can do in this space is really think about those teachable, simple coping skills that we can work with individuals on. Things like mindfulness, even just a deep breathing exercise or gentle movement. Or for a lot of individuals, I know the things that are de stressing for them are things like their hobbies. So having being able to carve out that space to engage in that hobby is really important. And when we talk about that type of self-care that's so important with stress, I want to sort of say that a lot of times self-care as a whole has really been commercialized and commodized to a certain degree. So we're told we have to buy this certain app, or go on this certain vacation, or go do this retreat. And I'll tell you right now, a lot of that's bogus, right? It's really about those simple things that work well for us, that bring us joy. And it doesn't have to be fancy or expensive. These very simple things can really make the world of difference as it relates to stress. And in lifestyle medicine, we have traditionally obviously talked about lifestyle change as really the first treatment option for a lot of different chronic conditions, both from, again, the prevention side of the house, but also management. So just because a person already has been diagnosed with a chronic condition, let's use diabetes, for example, doesn't mean that they can't, engage in some of this change behavior and really help better manage some of those things that are going on. And I'm going to share with you next. So, again, in lifestyle medicine, we've been talking about this for a long time. But what we're seeing now in healthcare is this movement towards changes in clinical guidelines for a number of different conditions that really emphasize nutrition and physical activity changes as that critical first line for preventing and treating chronic conditions before medication is prescribed. And so the next series of slides, I'm just going to cover a few of these in brief, just to kind of show you that movement that we're having or experiencing in this space. And this is from the U.S. Preventative Services Task Force, which does provide guidelines for lifestyle behavioral counseling for a variety of different conditions. And so you can see a list of those here. And I think we can go to the next slide for this one. This one's from the American College of Cardiology / the American Health Association. And as you can see here, we have circles around some of the lifestyle changes that an individual can be recommended to really help prevent cardiovascular disease. This is also seen here. You see the lifestyle advice piece from the practice guidelines for hypertension. And these are from the International Society of Hypertension. And it really, you can see here, lifestyle advice, making those changes from a lifestyle perspective is really listed as the first line of therapy after the established diagnosis. Likewise, the Joint National Committee guidelines also recommend lifestyle changes as an important component of therapy for hypertension. And then when we start looking at things like diabetes, the American Association of Clinical Endocrinologists and the American College of Endocrinology also state that lifestyle optimization is essential for all patients with diabetes. So I don't think I have this necessarily on this slide, but one of the things that they really reinforce is that lifestyle optimization as it relates to diabetes care and management is really multifaceted. There's a lot involved in it, really tying it back to these things like nutrition, physical activity, sleep, that an individual might need additional support in, and really trying to, from a diabetes support perspective, bring in the entire team. And then this is also from the American Diabetes Association, which does focus on guidelines for, bingo, behavior change for diabetes prevention. And for the American College of Cardiology, American Health Association, really focusing on from a heart health standpoint, focusing on things like lifestyle changes, healthy behaviors, really trying to connect, again, some of these key components of lifestyle medicine into the care that that individual is really focused in on. And then we have the American Institute for Cancer Research, which also offers this blueprint to beat cancer. And as you can see here, a lot of these areas again, focus with lifestyle medicine. So things like being physically active, focusing on nutrition. For example, limiting the consumption of red and processed meat, eating a diet rich in whole grains, vegetables, fruits, beans, limiting alcohol consumption. So really focusing in on those changes that an individual can implement. And the World Health Organization has also taken an approach of aligning some of their recommendations for risk reduction for cognitive decline and various types of dementias with lifestyle medicine. So as you can see here, that focus on physical activity, tobacco cessation, nutritional interventions, really focusing on these areas of an individual's health that can be helpful for them, and really reduce those risk factors. And in addition to prevention, I really want to make sure that we also understand that treatment and potential remission for a variety of chronic conditions is really part of this conversation when we're talking about chronic diseases. And on the other side of that, I want to be very clear about something. When we talk about lifestyle and lifestyle changes, it can also be an adjunct therapy for many other therapies that an individual might need. So sometimes it does not replace these other things that an individual needs to have. So, for example, surgery. So if an individual needs orthopedic surgery, for example, or heart surgery, or bariatric surgery, you know, lifestyle interventions are going to help with that piece. They might not necessarily replace them, um, but it also strengthens them. So if you're thinking about surgery, from surgery prep all the way to wound care that an individual might be experiencing or medications that they might have to be on, this can really be an adjunct therapy that can be really helpful for the individual. And lifestyle medicine really helps us achieve the quintuple aim in healthcare. As you saw when we were going through those list of recommendations that a number of different entities have put forth that focus on lifestyle change, it's really about serving to enhance other forms of treatment in some situations, but it can also be more from a more kind of global or macro level, thinking about the whole healthcare system, which is what we get into with the quintuple aim, which is looking at supporting the care team's well-being, enhancing the care experience, improving population health, reducing costs, and advancing health equity. And I believe this is my final slide. And what I want you to take from this today is that, when we talk about lifestyle medicine, engaging in some of these lifestyle changes really do lead to greater health benefits. We see improvements across the board for overall health. And in many situations, it can help in terms of the reduced risk of a number of different conditions that individuals, in particular, that I've worked with in the past, have fear surrounding, right? And so they're worried about, for example, their cognitive health and their risk for Alzheimer's disease. And so when we talk about this from this kind of perspective, I think it's really important that sometimes having these conversations with the patients and caregivers that you're working with and helping them to understand the value of this and the connection between lifestyle changes and better managing some of those conditions that they might be dealing with can be a very powerful tool in our care. And I believe the next two slides are just references. Yep. So thank you. You can connect with me via, I'll put my email in the chat, but you can also email Kristen if you have a lot of questions, and follow her on LinkedIn. Please don't follow me on LinkedIn. I don't know how that works exactly. So you can follow her though.
Thank you, Sam. That was great. Really appreciate it. We might have time for just one question. Does anybody have a question or a comment? I really liked the term lifestyle optimization. I have to say,
Yeah. Yeah.
optimize your lifestyle. It kind of, instead of talking about lifestyle medicine, but with our patients and our clients, we talk about optimizing their lifestyle. I like that.
The other thing I want to add to this very quickly, that optimization made me think about this. Sometimes I have noticed in my work with individuals is that the word lifestyle medicine is sort of like very academic for them. And so sometimes I talk about it as let's, health behavior change, or let's make some changes in our life, focusing on that piece and then connecting it to the hope for the future,
Mhm.
right? And really kind of getting to that piece. And so sometimes we have to reframe this based on where that, really going back to like meeting that person where they're at. So again, I don't know that you have to use the word sometimes lifestyle medicine, right? For it to be effective in terms of the approach.
Mhm.
All right. Thank you so much, Sam. I think what we're going to do is we're going to move on to the case we have today. Claire Bernard is going to go on and present the case, and hopefully what we can do is take all of the information that we learned and incorporate it into our case. So I'm going to now pass the mic to Claire, and you can go on and present your case. And I think Sam's going to be doing the recommendations as well.
I am indeed.
You have a very busy day, Project Echo.
Very popular today.
All right. Thank you, Sam. Claire?
Thank you so much. Hello, everyone. My name is Claire Bernard, and I'm currently an intern at Trager, specifically working within case management. And today I'll be presenting on one of my clients who I'm currently working with and have been working with for a few months now. And they are a 58-year-old Black female, currently in Louisville, but I'll talk a little bit more about that little change that might happen. She is highly independent and self-reliant. They do live alone, so that plays a big role in their independence, and they would like to keep it that way. However, the client is currently trying to manage self-manage their type 2 diabetes and also some dental health issues that have arisen, and also lacks health insurance coverage. She does have Medicare, traditional Medicare, but recently lost her Medicaid, and that was helping her out quite a bit. So that has been a recent challenge. Additionally, she does have 3 children, but they are all out of state. And so she doesn't feel like she has her social support in Louisville. She has been there for 10 years. And so she's definitely given it a shot, but she just really misses having her family and her closest friends near her. And so I will ask these 2 questions right now and then just ask them again towards the end as a little fresh reminder. But I would just like to know what possible solutions and suggestions may I have for someone who may not be motivated to make those social connections because, in this situation, they've already given it a try and it just hasn't worked as she pictured it. And then my second question is, how can I help them cope when it seems like the healthcare system, especially right now, with the current political climate, is just working against them? A little bit of background. I'll only be going over the primary diagnoses that I have discussed with the client, but you're more than welcome to read over any additional. So as I mentioned, we have definitely discussed type 2 diabetes as her diagnoses that she would really like to work on treating and also healing a part of her within that. She did participate in Miss Mona's diabetes self-management course and loved it, had so many great things to say about it, so much so that she is still motivated to get with an RD and just really learn a little bit more about what it means to live with type 2 diabetes and what can be done. We have discussed her mental health. So she does have a bipolar disorder diagnosis, manic depression, and also MDD, so major depression disorder. But this was at its peak during the beginning of this year. I will say, while speaking with her, she is very optimistic. And it has been like that for quite some time, and it has kind of gone up with the optimism, which is wonderful to see. Now she is very honest about what is going on in her life, but she's able to essentially kind of self-correct some of those negative self-thoughts. For clinical measures, for height, weight, and BMI, they're all as of June 4th of this year. So her height is 5'8", she is 189, and her BMI is 28.74. Blood pressure, there's no really concerns there. Now her LDL and HDL levels are a little bit on the higher end. As for the holistic background, functional limitations, really just having the motivation to leave the house. Also, she physically has a lot of pain going on, and so that has limited her ability to, go on maybe longer walks and whatnot. Cognitive function, I mean, memory is working really, really well. I'm able to recall quite, our discussions from months ago. Problem solving, like I mentioned, she does correct herself from time to time when there's some negative self-thoughts going on, and just general issues going on in her life. She'll find a solution before I can even approach with, a possibility or an option. The significant symptoms right now, I will say dental pain is high up there. She has gone through root canals in the past. She has a bridge, and it's just not really improving. And so that has caused her to only eat on the right side of her mouth. So she's really putting, her right side of the mouth on overtime, and that can really go backwards. Um, as for medications, I will just say that we have discussed her medication regimen on a very kind of basic level, just making sure that, it's not affecting her way too much in a negative way on her day-to-day life. She does have potassium because she had low potassium levels not too long ago, and some pain medications also. Nutrition wise, again, she really only eats on her right side or chews on her right side. So that has caused some dental pain. That has also caused her to only eat certain foods that won't aggravate that. And social determinants, I will say this and preface this, so knowledgeable. She really goes out of her way to really answer her own questions. Education wise, she does hold a master's in counseling. She did work in substance abuse for quite a while, and has done quite a few things within the work world, but she is currently unemployed. She does not have any advanced directives in place. Transportation wise, she does drive and have a working vehicle or has a working vehicle. And financially, that has been quite a challenge, especially with the loss of her Medicaid and also needing to pay the premium for her Medicare. Her rent is higher than what she used to pay, but safety is a really big concern of hers, and she feels safe where she is currently at. And so she does not want to make any changes with her living situation because of that safety. With psychosocial determinants, because of her MDD and bipolar disorder, she hasn't opened up too much about it during, our conversations, but she does currently see a therapist, and has really worked through past trauma with the therapist. As for cultural background, she does feel like, in her own words, she says that she feels like she sticks out like a sore thumb where she lives, although she does feel safe there. She feels like there's no one else there that looks like her, that might have a similar cultural background as her. And so she really wants to move somewhere where she can have that connection. Spiritually, she has made references to God and praying, but she doesn't currently attend church. And that is something that I would love to kind of explore with her. Education wise, again, she's currently unemployed, but she does hold a master's degree in counseling. And as for her family, I did mention that her 3 children live out of state, and she does keep in close contact with them over the phone, but doesn't see them in person much. and she does have 2 dogs. Individual health behaviors. She does not have any history with substance use, and does not currently utilize any substances. As for exercise, the main form right now is taking her 2 dogs on a walk, but it is very brief, because she feels like she can't go, longer than a few, maybe steps out of, or a few hundred steps. Eating habits, again, it's pretty inconsistent right now and limited also. And medications, there's no concerns in that end. With health services, she is on top of it. She is definitely, I mean, not just scheduling the appointments and following up, but she'll ask me questions that, kind of make me think outside of the box. And we do that with each other a lot. But when it comes to finding, a service that may help her financially or may help her within her dental needs, she'll definitely seek it out. And she does have a pretty solid medical team that she trusts, which I think is very important. With mental health services, she has seen her therapist for a little while now, and consistently sees them. With satisfaction with care, when it comes to the dental health part, she feels like a little bit disconnected. She feels like she can't open up too much about her concerns because she feels like she'll be judged. So there is a little bit of miscommunication on that end, but otherwise, she has a pretty good understanding, why she has a certain medical provider working on this area or why one area works with the other. For environmental, no fall hazards as of right now. There is an elevator in her complex that she utilizes from time to time, but sometimes she will use the stairs. Her home is fully equipped with fire detectors and also carbon monoxide monitors. Her home hygiene, she likes to keep it very nice and tidy. She does like to feel like she is at home when she walks through the door. Personal hygiene, she does take care of herself. With dental hygiene, that has been, again, a pretty issue. I know that you guys are like, she keeps mentioning dental, but that's just because it's a pretty big concern right now. And as for her environment, safety, check. But she does feel like she doesn't have that social connection within her neighborhood. And now her relationships within her medical team and social services team with her dentist, as I mentioned, they're very grateful to have the affordable services in place, but feels like there's a little bit of disconnection or some misconceptions there, and feels a little bit of judgment, whether that's been expressed or just feels like the judgment is going to come. Her endo, so they will be next week. Actually, my client will be going through a root canal procedure, hopefully, fingers crossed. And so that is the relationship that they have. Haven't seen them yet, but hopefully seeing them next week. And student care navigator, that's me. I am responsible for their case management needs and connecting them throughout the community and, to any available services out there that either the client is familiar with or maybe not familiar with. And also just making sure that I'm continuously working on building rapport with her. She has not complained about me. So, and or said, she says that she feels like she can open up, that we can have, talks about really anything. I'm a talker, so there's that. But, I try my absolute best to make sure that during our time together, there's absolutely no room for judgment. And the least that I can do is listen. Their relationship with their PCT, so responsible primarily for any checkups and med management. She has a pretty good relationship with her PCP. She feels comfortable calling them up for, any needs really. So no issues on that end. Has a pretty solid relationship with her therapist and with her RD. So she did schedule an appointment with her RD coming up. And so she hasn't seen the registered dietitian just yet, but looks forward to meeting them. So I went over a little bit, but primary medications to treat her low potassium levels, pain management, and also for BP and MDD.
All right. Thank you, Claire, for that presentation. Very thorough. So if we go back to the questions, the question was that I know there was a lot of dental pain though. So maybe is that being addressed, or should we assume that that's going to be addressed before we move on to 1 and 2? Do you need help with ideas about the dental pain or?
No, you're fine. Again, fingers crossed next week. There will hopefully be a root canal done that may alleviate some of the pain on her left side. So there are, appointments in place, but it's just a matter of financially, will it be covered?
Okay.
But the dental pain is still there.
Okay. Because I think it's hard to address number one if we're feeling so, awful and so much dental pain can cause so many
Mhm.
problems. All right, so let's assume that the dental pain is taken care of, as are the accompanying bills. What are some possible strategies and suggestions for an individual who's not motivated to make social connections? So let's begin there. Any suggestions, any comments that folks have? You talked about churches. Was she receptive to the idea of churches?
It's yes and no. I think it's more so just getting the foot outside of the door and actually going. But there's been like, oh, well, what if I don't really connect with anyone? Or what if I just don't feel like it's a good fit? And so that's been the biggest barrier. Also, getting there, she does have a car, but she doesn't really want to drive. Or outside of her medical appointments and the grocery store, she doesn't really see the need.
Had she been to a church before? Is there characteristics of the church that she had gone to before that you could capture?
It's the cultural aspect. And that's been a pretty common theme of, I just feel like there's not much representation, at least where I currently am, of people who look like me. Um, but that could just be really looking around, maybe even word of mouth, and seeing what could possibly be a good fit. But we haven't dug too deep into that conversation, just kind of surface level. And I'm looking at the chat right now.
Yes, I am too. I work on a faith-based kind of project, and I might be able to help you in that space.
That would be wonderful.
All right, so we've got Amber. Do you want to jump on and have a comment?
Yeah, I was just saying like positive motivation, maybe those I am affirmations in the morning and before bed to feel good about herself. And then I said support groups and also online support groups once you said that she didn't really like to drive and get out too often. There are online support groups for diabetes and for anyone. I've heard a lot about them in libraries and at other places.
Thank you.
Is she continuing with My Health Matters after having gone to Mona's? Uh,
She did the diabetes self-management program and loved it. I do plan to discuss because I will be sadly leaving in August. So I do want her to have more support from Traeger. And so I do plan to talk about My Health Matters and then also flourishing together. So
okay, great.
Yeah, I'd like to jump in here and just echo that. I think since she has already experienced a setting where she was able to interact with other people about this topic. It sounds like she would be a great candidate for both of those, My Health Matters and Flourishing Together, just to keep that going. And also just the social aspect of it. Even if, a specific week, maybe the topic isn't something so particular to diabetes, that having that community I see as being something that sounds like is something that matters to her, but also, that piece. I
Mhm.
do want to connect something though that you've said here about her in that you mentioned what mattered most to her was staying independent, which is very frequently what we hear. And so anytime you have the opportunity, and it does sound like she's really motivated, which is great, right? But to continue and reinforce that, really tying back anything that you're doing in that space to that anchor of her wanting to remain independent, I think is particularly useful from both a lifestyle medicine perspective, but also age-friendly, healthcare as well, and honoring that about her.
And connecting the need for social connection to optimizing her lifestyle and her health and her memory, because she's doing great in that space as well. Let's see, Nicole Daniels, would you like to jump on and have a moment to share your comment?
Sure. My comment, I've been her before. Um, so that it's very, very real to me. But I was just thinking that if she has different activities that she's interested in, like if she's really into reading or anything that the library might offer, they have so many great groups there that people are typically pretty welcoming. I've gone to a couple of cooking classes because that's also what I do at my job. And so, but people have been really welcoming. So going to something where she's already invested in that type of interest, I think might be really helpful. And what I was also going to type in was, since she's not currently working, possibly volunteering, especially along something in substance abuse, because there's so much to be done in that arena that I think that would be a good way to kind of um, funnel some of that energy that she may have to connect with people that way too.
Thank you. Yeah. All right. And then let's see. Amber also put in the chat online support groups. And Heather Cox, would you like to jump on and share your comment?
Sure, just tagging on kind of what everyone else, or most of what I had written has already been discussed, but getting out and about, getting connected with peers will not only obviously have mental health benefits, but it could also open up, a friendship for her, someone who's going through her similar situation or can identify whether it's someone who's also had substance abuse issues or is also a diabetic, also, having chronic medical conditions. It may, lots of times I find with clients, they often are able to identify other resources, that are maybe not so widely known that can be very beneficial to them, in a specific area or a specific arena of their situation too.
Yeah. Thank you, Heather. Other comments? Anybody want to jump on? Katrina, would you like to jump on and share your comment?
Yeah, I was just thinking if maybe she only goes to a few places. If like I was actually thinking about like the library, if it's in her route and maybe there's some specific hobbies that she likes, kind of like that parallel play where there's no pressure to engage with people. Maybe she would be interested in that.
If I'm not mistaken, the extension office also offers like cooking classes and some other support group things too, as well as the library. So those are both really good.
And a lot of the churches have welcoming ministries. So there might be, if you can connect them to the welcoming ministry, they may be able to find um, the right person to kind of, meet her at church if she wants to
Mhm.
be at church. Just to revisit that again. Any other comments? What was your second question? I think we have maybe 2 more minutes. The second question was related to,
How can I best support a client when it seems like the system, primarily the healthcare system, is just throwing like challenges left and right? Because that's what it feels like for her right now. And it's a tough one because, I think there's a lot of pressure for, at least I can speak for, from personal experience, to say the right thing. And I've learned that sometimes it's okay to just sit in that silence, as uncomfortable as it may seem. But I also want to help. um, so there's two sides of, not much that I can do, um, but I also want to do everything that I can.
Yeah, I'll add to this. I think listening is such a powerful tool. And sometimes within healthcare, especially if an individual is feeling like they're being bounced around or left behind or their voice is not being heard in their appointments, that is such a powerful intervention where active listening, right? And just sharing that space with that person is important. And sometimes we, in our world, from our perspective, we're like, okay, I got to do this and I got to do that, and you're checking a box. And sometimes with a patient, it's important just to put that all away for a moment and be in that moment with them and allow them to vent those frustrations and to get their voice out there about what they're experiencing. The other thing I would say is, to your best of your ability, navigating with them and not, you always want to walk the journey with them, right? You don't want to be like 4 steps in front of them, right? And reaching back and kind of dragging them along, walking alongside that with them and helping support them when they do encounter those situations that are tricky or challenging, can really be helpful as well.
All right. I think we're going to end it there. Thank you
Thank
so much, Claire. I hope we've got some recommendations that are useful. And we're going to go on and now hand the mic to Mona Huff, who's going to talk about, oh, is it Mona?
I was just going to say real quick, be on the lookout for the call for presentations, hopefully opening for the 2026 Optimal Aging Conference in mid-August. Actually, it's apropos for today's topic. The theme is going to be lifestyle medicine pathways to optimal aging. So please be on the lookout for that. And if you have a great age-related topic or anything related to lifestyle medicine, please watch for that call for presentations in August.
Thank you, Justin. So let's go on to the next slide. And we're going to talk a little bit about the Kentucky Coalition for Healthy Communities and how we, as a group, can work in our communities. And when we get information like this, to be able to share it. So what we want to do is train and empower our stakeholders and our community members. Our community members are so very important for us to work with, provide hope and education for their communities. I often say we can come to a meeting like this and say, oh my goodness, I learned so much. Good for me. But if it stays right here, then really this hour and a half is a waste. So we've got to figure out how we can become better because of what we learned, how we can share it with our families and our communities, ultimately our state, so that Kentucky can become a state that is known for good health outcomes. And most of you know that right now we're toward the bottom of the totem pole, and I don't think that's where we rightfully belong. And so our hope is that we can help you as an individual and then our communities to become healthier. So today we learned so much. And I would like for some folks just to unmute themselves and maybe tell us one thing that you learned today. And how can you share that information, whether you're going to share it with your family, your colleagues, your community, your workplace, whatever. So let me give you a few moments just to think about that and then to share with us.
I can go ahead. Something that I really liked listening to Dr. Cotton talk about lifestyle health, and when just seeing the numbers of how chronic issues and how so many of them are related to, substance abuse, smoking, drinking, just seeing those numbers. I think it was really helpful.
Yes, those numbers really spoke to us, didn't they?
Mm-hmm. And I'll definitely share that with patients.
Okay. Okay. Anyone else want to share? I know we learned so much today, you almost feel overwhelmed right now. And how can I get those things out?
I know that I'll be sharing some of this information. I'm always looking, I teach counseling students, and I'm always looking for information, particularly regarding working with older adults, because counselors have historically not been trained with that for that demographic. So just sharing that information is out there, that techniques are out there, that there are ways to help those clients. So it will be ongoing sharing. I'm sure as I learn more, I'll share more. But this has been a good start. So thank you.
Thank you, Sarah, for that. And one of the things I like to say to our aging, which I am one of those aging, and actually all of us are, no matter our age, we are aging, but I happen to be on the other end of the spectrum, really aging. But I want to say that it's never too late to make changes and to feel better. Um, my story goes back to when I was 56 and was very ill and made some changes because I didn't want to die laying on a couch. I wanted to die kicking my feet up, teaching somehow or another. So I made these changes, and I had to do my own research back in those days because back then I knew none of this and had no help. Thankfully, we've got this now for you, and we have done so much at Traeger to be able to try to get it out in the community. And it does my heart good when I hear that someone took the diabetes self-management class and really enjoyed and learned. The Flourishing Together class is going to teach you holistic ways to become healthier. And the My Health Matters, that's called education and support. And we do that every Monday night. We have a different speaker, a different topic. We let them present for about 20 minutes, and then we just talk together. So we support each other. Some nights we have open conversation. We don't even have a speaker. So if you've not ever joined My Health Matters, and it doesn't matter whether you're a professional, whether you're a community member, whether you're a student, it's good for our community members to know that our professionals have problems too. And then, of course, our students is learning in a really good way as they listen to everyone else and then share, because being a student is pretty stressful too. So let's go on to the next slide. So I'd like to give a time for each person that wants to. Yes, Amber, you're right. Chronic diseases affects everyone. And boy, do we talk about that a lot in our Flourishing Together and diabetes self-management. But I'd like to give you a time if you have something going on in your community that you would like us to know about. Perhaps you want us to attend. Perhaps you would like some help, and we could look and see how we could help. And also, as you're doing that, if you have any concerns in your community that you think that maybe we could look at and help you with, I want to give you a time for that. So I'll be quiet for a moment. Just unmute yourself if you wish to speak.
I'm going to put this in the chat, but the Alzheimer's Association is hosting their annual Walk to End Alzheimer's in the fall. In Louisville, it's going to be on October 19th, but I think they are hosting events also in Lexington and maybe someplace else in the state. So I'll be sharing information later, but here in Jefferson County, we'll be walking under Team Traeger. And so if you'd like to participate, we'd love your support, either as a walker or somebody who shares the information, and I can share that at our next meeting in September.
Okay, thank you, Justin. Anyone else? Okay, so let's go on to the next slide. And as we're going on to the next slide, I would like to remind you, if you have things going on in your community and you have a flyer, you can send those to Justin and he will make sure that they're shared with our group. We like to give you the time for that. So you've heard several times about My Health Matters, and so does yours. And that has become a meeting every Monday night by Zoom. Originally, I started it years ago as once a month in person for those folks who took the diabetes classes, the Flourishing Together classes, and at that time, I also taught Cooking Matters. And after these classes was over with, people would always say, "Oh my goodness, I just hate that they're over with. I wish we could stay in contact." And so I started doing this once a month. Well, then when COVID reared its ugly head, we decided we needed to do it weekly. And we was looking at it also as a way for folks that were lonely. And so it's turned into something much bigger than I ever dreamed of. And, you know, when COVID was over with, I offered to go to once a month in person and once a month by Zoom. And my participants just reared their heads and said, "No way, we want it just the way it is every Monday night." So that's what we've been doing. So this Monday night, we're going to be hearing from Greg Willett, and he's going to be talking to us a little bit about disability. And it's good for us to know so that we can have our eyes open in our community and even show up at community members meetings to help them understand what they need to do to help those that are disabled. As you can see, and you will get this PowerPoint afterwards. But August is a big month for us. Kristen, who was supposed to lead today, is going to be doing the whole month. And what she's going to be doing is telling us how we can cook in batch and be able to freeze it and have healthy meals when we come in from work too tired. And it also will help our budget. It's not just for convenience, although it's sure a lot more convenient than to have to cook a fresh meal every night. So please think about this and share it with folks. It's really a fun time when she leads for us. Okay, so let's go to the next one. So our Flourishing Together class, you've heard that mentioned. It is a 10-week class, and what we're going to be doing is teaching holistic behavior. And we're going to be talking about all these pillars that's been mentioned. And one of the things I always like to say to folks, especially when you're working with your clients, is start slow. They can't make all these changes at once, and you'll overwhelm them and they'll give up. And so that's what we do in Flourishing Together. We take one thing a week and we talk about it. So, oops, go back. I want to tell you a little bit what we do. We learn how to eat healthier, become more active, and learn how to manage and prevent chronic disease in a safe and encouraging social environment. We learn a healthier lifestyle to prevent and manage diabetes, heart disease, and other chronic disease. But you do not have to have a chronic disease to come, because you can also just learn good, healthy behaviors, and perhaps you will be blessed by not having these diseases. Okay, next slide then. So the diabetes self-management class is a 6-week science-based program to learn how to manage your diabetes, or if you have pre-diabetes, to learn what to do so that perhaps you will not get diabetes, or even if you do, you'll be able to postpone it. And the longer you can postpone a diagnosis of diabetes, the more likely you are not to suffer with great complications, because the longer you have diabetes, the more risk for complications. Our preference is given to those that are 60 and above. That does not mean if you're below 60, we won't take you, but if our class is full, we would put you on the list for the next time. The sessions are held by Zoom, and you do need a computer with audio and video, and that's required because we cannot do a class and have the relationships that we want to form looking at a blank screen. What you're going to learn, we are going to talk about healthy eating. As I said earlier, we're going to ask folks to gradually do these things, because if you go from one extreme to the other overnight, you're going to have a terribly low blood sugar, perhaps even a medical emergency, and you're going to think Mona's crazy and you're not coming back to class 2. But if indeed you're working alongside your primary care provider or your endocrinologist, and they know what you're doing and are watching your blood sugars really close, or they have told you that you have to make a change immediately, then that will work. But otherwise, we do it a little bit at a time. The same thing is true with our movement. If you've been a couch potato, you don't go out and do 3 miles the first day. You may do 50 steps the first day, but we're going to increase a little bit every week. Monitoring, we want you to know how important it is to monitor your body. We do action planning every week. We do stress management, avoiding complications, problem solving, and more. So if you are interested in our next classes, which will be starting in September, we're going to have a Tuesday afternoon class and a Thursday evening class. You can go ahead and register for that, or if you want to know more about it, here is a phone number to Jennifer, who's my co-facilitator. Okay, so let's go on to the next one. So I want to talk to you a little bit about some other programs that we have at Trager. The Flourish program was our first program, and how we came to come together just like this. We wanted to be able to help adults with multiple chronic conditions to improve life satisfaction through comprehensive care navigation program. And we knew that the doctor couldn't do it all. And, insurance is not very kind toward how long they let them visit with their patients. And so we had to figure out a way to be able to integrate our social workers, our community health workers, and these educational programs on the outside. So caregiving program we have, and again, that is for someone who's caring for someone who is 60 and above, and they will help you get the support and resources that you need. If you or someone you know is interested, please go to this survey and you'll hear from the program manager within a few days. And I give a plug for that program. I have been a part of that program, and I'm not sure how I could have made it without it. Virtual friendly visitor program. This is another program that is so great that started during COVID. We meet with people over the phone or computer, virtual visits, and they are having problems with isolation or loneliness. And our our practicum students will work with them, and they are very well trained and are able to recognize if they need further help and do referrals as well. And our Pearls program is another good program where you'll be working with one of our students, and it's a way to rediscover joy, purpose, and connection. So that might be a program for today's patient. So again, there's a phone number to be able to call for that. And if you want additional information, you can get it here. Okay. So we want to start talking about our challenge walk that we do every year, September 1st through the 30th. You just keep your steps. We will be sending you information how you can enter those. And the county who will have the most steps, we have them divided according to size. And actually, I don't know what happened, Justin. We redid that, but for some reason it's not in here. We are now giving a certificate to the winning county instead of the trophy, because we have lost some trophies in a county. And we're going statewide, so it would be hard to be able to get a trophy to them. So now they'll be getting a certificate. If you want to be a part of the planning committee, please let me know. We'll be starting that soon. We want to find really creative ways to get this advertised throughout the state of Kentucky. And hoping that as they walk for this month, then it will become one of their healthy behavior changes. And that's what we like to hear about. Okay, let's go on. All righty, becoming an optimal aging scholar. Is there someone that would prefer to talk about this, or do you want me to go?
I can, thank you. So if you're interested in becoming an optimal aging scholar, and I'll put Sophia's email address in the chat. Basically, this is a way for you to gain some valuable training in geriatric care, get a deeper dive into age-friendly healthcare practices, and working with an interdisciplinary team. Really, we have some real basic program requirements that are over here on the right. And if you reach out to Sophia, we can get you additional information about upcoming trainings and how you can be involved. So thank you, Mona.
Mm-hmm. And that is great. I did that last time around. Okay, so our coalition, we want to become an even more effective state coalition, working with community members and community-based organizations to empower our state to become a healthier and compassionate people. Therefore, we as individuals need to practice our own self-care and model healthy behaviors to our families, our coworkers, and members of our community. One of the things I say to facilitators that I train, please don't go into class with a Coke. Let's model healthy behaviors. And we need to be thinking about that, not only for those that we are taking care of as far as clients, but for our children, our grandchildren, and our community as a whole, even within our churches. Some of the greatest things that I have seen within our church is one of my churches here in Henry County decided their fellowships were going to be healthy. And the church does baked chicken themselves. No other meat is allowed to be brought, and they are told to bring a healthy dish to share. And the pastor that did that, he himself said to me, I look out over my congregation and seeing these folks falling asleep because of high blood sugars, because they can't sleep well. And I know several strokes, and on he went. And here we are at our fellowship, just feeding all of those chronic diseases. And we've seen some great things happen. So we want you to be a part of that. Okay, I will hand it back over to.
Okay, thank you, Mona. So this is again our schedule for the rest of the year. We're taking a break in August. We hope you will join us back on September 19 with Nutrition and Bone Health. And I am going to put the session evaluation in the chat. So, and please go ahead and do that session evaluation. And if you are a community health worker, you must complete it to receive a certificate. So thank you, everyone. We hope you have a great weekend. We appreciate you being here. Thank you, Sam, for pitching in there at the last minute. Thank you, Claire, for the great case presentation. And we'll see you in September.